Hi, I'm Christian Brindle, and welcome to the Everything Medicare Podcast.
What's up, Everything Medicare Podcast Nation? This is Christian Brindle, wherever you are and however you might be listening to me today. Thank you so much for taking the time. This is episode 206. Every single week, I bring you 3 podcast episodes where we discuss your Medicare, your Medicaid, your Social Security, and everything that has to do with that golden age called retirement. If you're not familiar with who I am, my name is Christian Brindle. I own a company called Christian Brindle Insurance Services, and we work with people on the Medicare health plans of all different shapes, sizes, situations, and everything else in between. I've published 3 books about insurance, 2 specifically about Medicare, and I'm just thrilled to be here with you today on episode 206. Folks, there are 2 different wavelengths in terms of what people are looking for when they're getting onto Medicare, or when they're already on Medicare. You can be covered well enough to get by, basically the bare minimum, or you can be covered on all fronts. And when I say covered on all fronts, you have basically the best combination of coverages and policies all working simultaneously to cover you, no matter basically what's going to happen to you. I would call this top shelf coverage in all different scenarios. Now, you've heard me say probably on this show before that Medicare supplement plans are top shelf coverage, and they are for medical bills. But there's a lot of things they're not going to cover, like they're not going to cover prescriptions, because Medicare doesn't cover prescriptions. Remember, the rule of thumb with a Medicare supplement is Medicare has to pay first. The supplement will then come through and pay afterward. Medicare pays 80%. The supplement plan pays 20%. The supplement will not pay for any bills that Medicare does not pay for. An extension of this is Medicare doesn't cover prescriptions, but it also doesn't cover long-term care, such as staying in an assisted living facility or in a nursing home. Now, nobody wants to think about that, but Medicare doesn't cover that. I mean, though it'll fall under skilled nursing for the first 100 days, and then after that, you're on your own. So, what is the best way to be covered on all fronts? Medicare, of course, doesn't cover dental, vision, hearing. What's the best way to be covered on all fronts? And, of course, this isn't for everybody. There are people that would just rather go with a Medicare Advantage plan, be covered at the bare minimum, which not to say that Medicare Advantage is bare minimum or bottom level coverage. It's not. It's actually very good coverage, and we've talked about that in nauseating detail on the show. But it's not top shelf like a Medicare supplement. And, of course, you pay top shelf premiums for Medicare supplement. And to be covered on all fronts, you're probably going to be paying a hefty premium bill, because insurance is no different than anything else. In most cases, you get what you pay for, right? You get what you pay for, folks. And this is what we got to understand. Now, people will automatically think, like I said, picking up a Medicare supplement with a drug plan is top shelf coverage. But like I said, you're still left exposed in the long-term care, the dental, vision, hearing. Part D plans only covers things like cancer medication so well. And so what can you do? Well, what's a good combination of policies? Now, me, myself, I've done an episode recently about kind of some policies that I have put together. I don't even think I'm necessarily covered on all fronts, but I do have multiple policies. So I have a short-term medical plan on myself with a company called National General. Now, it doesn't cover a lot of things. It doesn't cover cancer. It doesn't cover pre-existing conditions. Now, I don't have any pre-existing conditions, but you get my point. So I have a cancer policy. I have $1 million life insurance policy. I have dental, vision, and hearing policies on myself. I'm not covered on all fronts, but I'm covered better than probably 99% of the population. Maybe not 99%, maybe 90%. Maybe I'm exaggerating a slight bit. But folks, there's a way for you to be covered on all fronts on Medicare without paying $1,000 a month in premium. And that's what we're going to talk about after I take a quick break and hear from this week's sponsor. I'll be right back. Don't go anywhere, and I'll unveil exactly how I believe that you can do this while on Medicare. Don't go anywhere. I'll be right back. Welcome back, everybody. Thanks so much for sticking with me through that break. Let's talk about how to be covered on all fronts when you're on Medicare. So let's start with the basics. Of course, you're going to have A and B. Medicare Parts A, Medicare Part B. And they're going to cover 80% of your medical bills. You're going to be paying $144.60 a month for Medicare Part B. So I'm basically going to add up roughly what this is going to cost you. Now, this is not going to be the same everywhere because different markets have different prices for different things. But one thing that's the same everywhere is the Medicare Part B premium, unless you're in a higher tax bracket, to which point you can potentially pay more. That's a podcast that we've done about 3 different occasions. I'm not going to get into that today. But let's just assume you're at the $144.60 mark for Medicare Part B. So you're paying that. Now, obviously, if you want top shelf coverage and be covered on all fronts, you're going to have a Medicare supplement. You're just going to have to. Because at that point, you're going to have full medical coverage for things like doctor's appointments, surgeries, hospitalizations, and et cetera, et cetera. You're going to have no out-of-pocket or very close to very little out-of-pocket, very close to no out-of-pocket, depending on the supplement. Now, supplement, depending on the state you live in, can cost probably anywhere between $100 a month and maybe $300 a month, depending on your market. So let's meet in the middle here. Let's say, worst case scenario, you're paying $200 a month for the med sup. In most states, you're probably going to be looking at more like $150. So just because of that, I'm going to say $150. Now, this is going to be more in a lot of areas like New York and California and Florida. New York and Florida specifically are the two that come to mind. But we're just going to say $150 just because a majority of states, it's probably going to be more roughly, give or take, something like that. So you have a med sup. You're now at $294.60. So we'll just round it up, say $295. Now, like I said in the first segment, Medicare Part D plans are necessary because Medicare and Medicare supplements don't cover that. So let's say you take let's say you take the best drug plan based on you. There's not one drug plan that's going to cost $100 a month that's just head and shoulders above everybody else. I've done episodes about this as well. This is going to be based on the specific prescriptions you take. Every single Part D prescription drug plan is based on the specific medications that you take specifically. They all have different formularies of drugs they cover well and drugs they don't cover well, and you have to pick the best one for you. So let's just say $30 a month. Could be more, could be less, depending on what you need. Now, every single Medicare Part D prescription drug plan covers cancer medications incredibly poorly. They're going to put them in the category of Tier 5. Medicare Part D drug plans categorize medications in categories, basically called tiers, 1 being the lowest, 5 being the highest. The higher the tier, the higher the out-of-pocket. I recommend taking a cancer plan. Usually they're about $30 a month to get something halfway decent. It could be more, it could be less, depends on how much coverage. But we'll say $30 a month for a cancer plan. We're now at $354.60 a month. So $355. We'll add on 40 cents to round up. So we're at $355 at this point. You're not covered for long-term care. You could probably get a halfway decent long-term care plan for $150 a month, or you could get a short-term care plan that'll cover you for a year for probably $50 a month in most places. Let's just say you did a short-term care plan, so we're not breaking the bank. It'll cover you for up to a year in an assisted living facility. So we're now at $405. You're not covered for dental, vision, hearing. Let's say you pick up one of those. That's another $30. You're now at $435. I usually recommend having some kind of life insurance. Depending on what you want, what you can qualify for, probably would cost you $60, $70 a month maybe. I'll just say 70. It could be more, it could be less, depends on the type of coverage you need, but I recommend having life insurance. I don't think you can be covered on all fronts without life insurance. So that brings us to $505. Depending on where you live, you can probably be covered on all fronts for $505. You're going to need to pick up several different policies that all do something different to do this. But I think it's smart because what you're going to be getting in that sense is if you need to go into an assisted living facility, you're covered for a year. depending on how good your short-term care policy is, you're going to be covered most of it for the whole year or all of it. You're going to have little to no medical bills for hospitalization, surgery, anything like that for your Medicare supplement. You have your drug plans covered, and then if you ever do get cancer, your prescriptions on the cancer side of things, those expensive Tier 5 medications are going to be covered and helped by the cancer plans. The cancer plans will come in and pay $10,000, $20,000, $30,000, $40,000, $50,000, depending on what kind you get towards these cancer medications, which is going to help out. You're covered on the life insurance in case something unexpected happens to you. Your family's taken care of. So I'd say to get top shelf coverage to where you're covered on all fronts, you're probably going to be looking at anywhere between $500 a month to $800 a month, depending on where you live. Folks, I hope this was interesting. I certainly thought it was, kind of putting this together. And as always, hope you enjoyed this episode. Until next time. Excuse me. Until next time, folks. Take care. Have a great rest of your weekend. This is a short little episode, and I hope you enjoyed it. Thanks for listening. We'll be back with you with another episode on Monday. Take care.